There are 5 particular points of interest with respect to our patient. As we mentioned before, fluid overload seems to be one of our primary concerns. Signs and symptoms seem to indicate that this is a potential problem with our patient, and we need to rule this out before we move forward. A second concern of ours is that with respect to fluid overload, we have to assess whether or not the hemodialysis that has been conducted on this patient has been sufficient in terms of the blood flow rate and the hemodialysis rate. In addition, we have a patient history of diagnosis for diabetes, and we know that the patient had also stated intense thirst, bringing 2 large cups of ice water to the hemodialysis clinic, claiming severe thirst, which to me might indicate polydipsia as a consequence of uncontrolled blood sugars from his diabetes. Furthermore, the patient did state that there were changes in his blood pressure medication. We have to find out exactly what that means, whether or not the patient has been compliant with their new medication, and so forth. Finally, we have to incorporate all these different things with respect to fluid overload and consult with the nephrologist as well as the medical doctor to determine what we need to do moving forward to improve this patient's condition.